From what research tells us so far, it's clear that people of color are being disproportionately affected by COVID 19. Today, we're here to explore that topic more. Just how many people of color are being affected by the virus? Why is this happening? And what can we do about it? My name is Maddie Brown, and I have Emily Ellison and Rochelle Varney here to join me in this discussion.
This is Emily, and I'd like to talk about some facts about COVID 19. Johns Hopkins reported that in Chicago, half of the population who have tested positive for COVID 19 are African Americans, even though they only make up a third of the population. African Americans also are unproportionately dying of COVID 19. They make up 3/4 of the deaths. The same thing is happening in Milwaukee County, Wisconsin. African Americans account for 1/4 of the population, but nearly 3/4 of COVID 19 deaths are African Americans. The CDC reports that New York identified death rates were substantially higher in the African American population than in the Latino, white, and Asian populations. In deaths per 100,000, Asians had 34.5 persons, whites had 45.2 persons, Latinos had 74.4 persons, and African Americans had a staggering 92.3 deaths per 100,000 people. That's more than double the white population. I want to read a quote from the CDC article, COVID 19 in Racial and Ethnic Minority Groups. The conditions in which people live, learn, work, and play contribute to their health. These conditions over time lead to different levels of health risks, needs, and outcomes among some people in certain racial and ethnic minority groups.
Racial and ethnic disparities in healthcare are nothing new. Many studies have been done to determine the factors that create these inequalities, and this can help us understand why people of color are being disproportionately affected by COVID 19. Some significant factors that contribute to the disparities in healthcare include work circumstances, access to healthcare, housing and resources, underlying health conditions, and the effect of stress on immunity. 63% of Latino or Hispanic workers and 54% of Black workers earn low wages, compared to 37% of white workers. Many people of color are essential workers, providing food services, for example. Not having the option to work from home leads to a higher rate of exposure to the virus for these people. And of course, these jobs often don't have paid sick leave or access to health insurance. Compared to whites, African Americans are almost twice as likely to be uninsured. This makes it difficult for them to manage chronic diseases, and some individuals might not even know they have a chronic disease due to the lack of health care. A patient with badly controlled diabetes or asthma, for example, is more at risk for a severe or even deadly case of the virus. Just like healthcare, other important resources can be hard to access as well. Due to the longstanding history of housing discrimination and redlining, generations of African Americans have been pushed to live in areas that lack access to healthy food options. Many have to rely on a high-calorie, affordable food rather than overpriced and less available fresh produce. And of course, this also directly impacts health, resulting in chronic diseases such as diabetes, high blood pressure, and obesity. This puts them at a higher risk of getting the virus. According to the CDC, about 90% of those hospitalized with severe COVID 19 cases had at least one of these underlying medical conditions. And we also have to remember how stress can affect us. Income inequality, discrimination, violence, and institutional racism all contribute to chronic stress in people of color. Many studies have proven that chronic stress has a physiological effect on the body and can wear down immunity. This makes people of color more vulnerable to infectious diseases, such as COVID 19. Compared to whites, African Americans experience higher death rates and prevalence rates of chronic conditions. So, what can be done about these things? To explore that question deeper, we're going to hear from Rochelle and Latrice.
Hi, this is Rochelle Varney. Today we have Latrice, a social worker from Mid-Michigan Health.
Hi, Rochelle. Hi, Maddie and Emily. Thank you for inviting me to be part of this podcast today.
It's our pleasure. All right, let's get started. What are some ways that social workers can advocate for people of color during COVID-19 on a macro level?
On a macro level, social workers can write to a local and national officials demanding change on behalf of the people of color to make sure that their needs are being met during this pandemic through changes in local, state, and federal policies.
Awesome. What about the meso level with small groups such as families?
On a meso level, social workers can develop cultural humility when working with families by actively learning from people of color on what their needs are, what they find important, and start advocating for those changes.
How about the micro level, so one on one basis?
On a micro level, social workers can watch for microaggressions within their social circle, social media, etc. They can also challenge the individuals who say things with that they have learned on a meso level.
Yes, that's very important. So, how can social workers ensure that people of color receive adequate care and help that they need during COVID-19?
Social workers can make sure to have an open dialogue with patient and family and make sure that they are communicating needs that patients and families are not being addressed by the medical team.
What would you say some of these needs are that aren't being addressed?
Some of the needs are a lack of transportation to and from doctor's appointments due to the city transit system being shut down. Many individuals and families are not able to afford their prescription drugs, and others may be having medical insurance related issues or no medical insurance at all. These same individuals and families also may not have transportation to get to a COVID 19 testing site. There were already so many barriers in place that colored people of color were already facing before this pandemic, and now more barriers have been placed in front of them. It is our duty as social workers to uphold the NSAW Code of Ethics and ensure that we are advocating for the needs of the most vulnerable population.
Thank you for clarifying that for us. My next question for you, Latrice, is what can social workers do to help reduce increased mental health issues to children during COVID-19?
On the inpatient side, social workers can check in with pediatric patients and parents and ask how they are coping and continue to screen for any concerns regarding mental health. By meeting the mental health needs of adult caregivers, it will positively influence children in the household.
I appreciate that you included both caregivers and children. It is also important to determine what social workers can do to help families cope with anxiety and depression during social distancing. Do you have any advice?
Social workers should be up to date on the latest technology and offer to show patients and families how to stay connected with others through video chats, texting, calling, support groups, etc. They can also provide mental health resources located within the individual or family area where they live or somewhere close by. At Mid Michigan Health, we screen all patients for suicidal thoughts during their visits. During the social work assessment, it is important to talk about stressors associated with social distancing, like fear and anxiety that is related to contracting COVID 19, substance abuse, financial concerns, and the grief experienced during the lockdown due to families being unable to visit loved ones in the hospitals and nursing homes. In addition, families are not able to properly grieve or have a regular funeral service for their loved one who passed away because there is a 10% limit in place for the number of people who can attend the service. This creates even this creates more anxiety and depression, especially for individuals and families who were already dealing with anxiety and depression pre-pandemic.
Thank you, Latrice. If you go to our COVID 19 podcast website, you'll be able to find available resources Latrice just mentioned. Our last question for you: how can social workers educate and support parents of color during social distancing to ensure that their children get the support that they need?
Social workers can advocate to make sure that parents and children have adequate internet, access to technology, as well as support for families in home who have been forced to homeschool their children due to COVID 19 with the assistance of teachers through online learning. If parents and children do not have access to internet, technology, or other various needed items to learn from home, social workers should offer resources for places that they can go to get the work done, such as libraries or community centers if they are open. Every social worker should do some research to find out what resources are available and compile them in a list that is readily available to give individuals and families in need. Some of these resources should include access for mental health needs, financial assistance, help with utility assistance, free internet services, help with rental and housing assistance, free COVID 19 testing sites, free masks, and food resources.
Thank you for joining us, Latrice. You have been very helpful.
Thank you, Rochelle, Maddie, and Emily, for allowing me to join today. It has been a pleasure talking with you.
I want to thank you all for listening to our podcast today. We hope that we have helped shed some light on the issues for people of color during this COVID-19 pandemic. Thank you.